Have you ever considered how mental health professionals manage to diagnose and treat a variety of complex mental health conditions? It's not magic, nor is it guesswork. It's through a systematic process known as mental health assessment and care planning. And it's every bit as crucial as it sounds. Mental health assessment is the first critical step on the road to recovery. You see, mental health conditions are not as straightforward as physical ailments. They can't be detected by a simple blood test or an X-ray. They require a comprehensive evaluation that delves into a person's thoughts, feelings, and behavior. This assessment forms the basis of understanding a person's struggles and recognizing the signs and symptoms of potential mental health conditions. But it doesn't end there. Once a diagnosis is made, the next phase is care planning. This is where the real magic happens. Care planning is the blueprint for treatment. It's a personalized approach that considers an individual's unique needs, preferences, and goals. It outlines the strategies and interventions to be used, the expected outcomes, and the ways to track and measure progress. These two processes are inseparable. The assessment informs the care plan, and the care plan guides the treatment. They work hand in hand to ensure that individuals with mental health conditions receive the most effective treatment possible. Why is this so important? Because mental health conditions are more than just a diagnosis. They affect every aspect of a person's life: their relationships, their work, their self-esteem, and their overall well-being. Without a thorough assessment and a well-thought-out care plan, we risk missing the mark in treatment, leading to ineffective interventions, prolonged suffering, and even a worsening of the condition. So, whether you're a mental health professional or someone who cares about mental health, remember this: mental health assessment and care planning are more than just clinical procedures. They are the pillars of effective mental health care, the tools we use to bring light back into the lives of those living in the shadow of mental illness. Understanding the process of mental health assessment and care planning is essential to effectively manage and treat mental health conditions. An assessment is the first step in the process of diagnosing and treating mental health conditions. It's like opening the door to a room that's been kept in the dark. You don't know what's inside until you shine a light on it. So what does the mental health assessment process entail? Well, it's not a one-size-fits-all approach. It's a multifaceted process that aims to create a holistic understanding of the individual's mental health condition. Firstly, there's the clinical interview. This is where trained professionals sit down with the individual and discuss their thoughts, feelings, and behaviors. It's a conversation, but not like the ones you'd have over a cup of coffee. These conversations delve deeper, exploring the individual's emotions, daily routines, relationships, and any symptoms they might be experiencing. The clinical interview is not about making quick judgments. It's about listening, understanding, and making connections to piece together a comprehensive picture of the individual's mental health. Next up, we have the medical history review. This looks at both the individual's personal and family medical history. Have there been any previous mental health conditions? Any physical conditions that could impact mental health? What about the family tree? Are there any instances of mental health conditions? This information can provide vital clues to understanding the individual's mental health. Lastly, we have psychological tests. These might sound intimidating, but they are simply tools used to measure and observe a person's behavior to arrive at a diagnosis. These tests can range from questionnaires and checklists to complex tasks. They're designed to assess a wide range of mental functions, such as memory, attention, reasoning, and mood. The results of these tests can help paint a clearer picture of the individual's mental health. They can provide insights into aspects that may not be apparent through conversation alone. But remember, these tests are just one piece of the puzzle. They are used in conjunction with the clinical interview and medical history to form a comprehensive assessment. It's important to note that the mental health assessment process is not a race. It's not about reaching a diagnosis as quickly as possible. It's a journey that requires patience, understanding, and compassion. It's about providing the individual with the best possible care and support. The mental health assessment process is a thorough and comprehensive way to understand an individual's mental health condition. It opens the door to understanding, and with understanding comes the ability to provide effective care and treatment. And that, dear listeners, is the true power of a mental health assessment. After an assessment, the next critical step in mental health treatment is care planning. This stage is absolutely pivotal in guiding the course of treatment and ensuring that the patient's needs are met. Care planning is essentially the roadmap to recovery. It's a detailed, comprehensive strategy that outlines the way forward after a mental health assessment. This plan is not a one-size-fits-all approach. Rather, it's individualized, tailor-made to fit the unique needs and circumstances of each patient. So, what does care planning include? There are several key components. First and foremost, it involves setting treatment goals. These goals are not just about managing symptoms, but also about improving the overall quality of life for the patient. They might include objectives like reducing anxiety levels, improving social interactions, or enhancing self-care skills. These goals, while set by the healthcare professional, are always in consultation with the patient, ensuring their active involvement in their own treatment. Next, care planning involves determining the best therapeutic approach. This could mean cognitive behavioral therapy for someone dealing with depression, or perhaps dialectical behavior therapy for someone with borderline personality disorder. The choice of therapy depends on the patient's diagnosis, their personal preference, and what has been shown to work best for their particular condition. Then there's the decision about medications or other treatments. Medication can be a useful tool in managing mental health conditions, but it's not always the only or best option. Care planning takes a holistic view, considering all possible interventions, including lifestyle changes, physical activity, and alternative therapies. In essence, care planning is a collaborative effort between the healthcare professional and the patient. It's about working together to create the best possible plan for managing the mental health condition. It's a process that respects the patient's autonomy and values their input, while leveraging the expertise of the healthcare professional. In conclusion, care planning is a collaborative effort between the healthcare professional and the patient, aimed at effective management of the mental health condition. So, what are the key elements of a mental health care plan? A mental health care plan is like a roadmap, guiding the journey towards improved mental health. It's not just a document, but a dynamic, evolving strategy that is tailored to the unique needs of each individual. Let's dive into the key elements that make up a robust mental health care plan. First and foremost, a care plan begins with treatment goals. These goals are the destination of our roadmap. They are specific, measurable, achievable, relevant, and time-bound, or as you might know it, SMART. Each individual's goals will be different, reflecting their unique experiences, challenges, and aspirations. For one person, the goal might be to reduce anxiety levels, while for another, it might be to rebuild relationships that have been strained by their mental health struggles. Next, we have the therapeutic approach. This outlines the methods and techniques that will be used to achieve the treatment goals. There are various therapeutic approaches available, from cognitive behavioral therapy and psychotherapy to creative therapies such as art or music therapy. The choice of therapy will depend on the individual's specific needs, preferences, and the nature of their mental health issues. Now, let's talk about medication management. For some individuals, medication may be a crucial part of their care plan. This aspect of the plan details the type of medication, dosage, frequency, and duration of use. It also considers potential side effects, interactions with other medications or substances, and plans for monitoring and adjusting the medication as needed. Remember, medication is not a one-size-fits-all solution, and it's not always necessary. But when it is, it's essential to manage it carefully and responsibly. The final key element of a mental health care plan is the follow-up plan. This is the part of the roadmap that ensures the individual doesn't get lost along the way. Follow-up plans include regular check-ins to assess progress, adjust treatment as necessary, and provide ongoing support. This could involve appointments with a psychiatrist or therapist, group therapy sessions, or check-ins with a primary care provider. In essence, a mental health care plan is a holistic, comprehensive strategy that takes into account the many facets of an individual's life and mental health. It's not just about treating symptoms, but about supporting the individual in their journey towards improved mental health and well-being. A well-crafted care plan is a collaborative effort involving the individual, their healthcare provider, and often their loved ones. It respects the individual's autonomy and preferences, while also drawing on the expertise and experience of mental health professionals. It's important to remember that a mental health care plan is not set in stone. It's a living document that evolves as the individual progresses on their journey, reflecting changes in their circumstances, goals, and needs. These elements ensure a comprehensive and individualized care plan for each patient. With a well-structured mental health care plan, we can help guide individuals on their journey towards improved mental health and well-being. Healthcare professionals play a crucial role in the process of mental health assessment and care planning. They form the backbone of the mental health system, providing the necessary care and support to individuals dealing with mental health issues. Let's delve into the roles of different healthcare professionals in this field. Psychiatrists, for instance, are medical doctors who specialize in diagnosing and treating mental illnesses. They can prescribe medication, provide psychotherapy, and implement other treatment methods. Their deep understanding of the human mind and body enables them to create comprehensive care plans that address both the mental and physical aspects of a patient's health. Meanwhile, psychologists focus more on the therapeutic treatment of mental health issues. They use various forms of psychotherapy to help individuals understand and manage their problems. Psychologists often work closely with psychiatrists, contributing their unique perspectives to the development of a patient's care plan. On the other hand, social workers play a pivotal role in connecting individuals with the resources they need to manage their mental health. They may help patients navigate the healthcare system, access community resources, or cope with the social implications of their mental health issues. Their work ensures that care plans are not only medically sound, but also practically implementable in the patient's daily life. Then we have mental health nurses who provide direct care to patients, often working alongside psychiatrists and psychologists in various settings. Their role can include administering medication, monitoring a patient's progress, and providing emotional support. Lastly, occupational therapists help patients reintegrate into their daily routines and activities. They address the practical challenges that mental health issues may pose, such as difficulties with self-care or work tasks. Each of these professionals brings a unique set of skills and expertise to the table. Their roles may differ, but they all share the same goal: to provide the best possible care to those dealing with mental health issues. The expertise and input of various healthcare professionals ensure a holistic approach to mental health care. To sum up, mental health assessment and care planning are two fundamental processes in the effective management of mental health conditions. Over the course of this discussion, we've unpacked a multitude of elements that underline the importance of these processes and their role within the broader context of mental health care. We kicked off with the significance of mental health assessment and care planning. These processes are not just mere formalities. Instead, they serve as the bedrock of any effective mental health intervention. They help us understand the individual needs of each patient and guide us towards a tailored approach to treatment, thereby ensuring better outcomes and improved quality of life. We then delved into the mental health assessment process, a comprehensive and detailed evaluation of a person's mental state. This isn't simply about diagnosing a condition, but rather about exploring the full breadth of factors that can influence a person's mental health, from their medical history to their current circumstances to their future aspirations. It's through this detailed understanding that we can begin to formulate a truly effective care plan. Our exploration of care planning in mental health emphasized its role as a roadmap for treatment. It's the blueprint that outlines the steps needed to reach a desired outcome. An effective care plan is not set in stone, but is a living document, adaptable to the changing needs and circumstances of the patient. We highlighted the key elements of a mental health care plan, from setting realistic and achievable goals to identifying potential challenges and devising strategies to overcome them. It's about fostering a collaborative environment between the healthcare professional and the patient, where both parties work together towards the common goal of improving the patient's mental health. And finally, we discussed the role of healthcare professionals in mental health care. It's not just about prescribing medication or conducting therapy sessions, but also about advocacy, education, and support. Healthcare professionals are a vital link in the chain of care, bridging the gap between the patient and the resources they need to manage their mental health effectively. In essence, mental health assessment and care planning are intertwined processes that are crucial to the successful management of mental health conditions. They are comprehensive, adaptable, and patient-centered, designed to provide the best possible care for each individual. And while we, as healthcare professionals or members of the wider community, play a crucial role in these processes, it's important to remember that at the heart of it all is the patient. Their experiences, their needs, their aspirations, these are what guide and inform our approach to mental health care. Remember, understanding these processes can empower us to better manage mental health conditions and ultimately lead to more effective treatments.